Hey guys, Dr. Brooke, and we are back with our talk on carpal tunnel this month. So we talked about how carpal tunnel is compression of the median nerve that runs up through the wrist, whether that's getting caught because the transverse carpal ligament is tight, whether your muscles are tight, whatever the reason is, it's getting compressed and it's causing that numbness and tingling, weakness in the grip, and pain, sometimes swelling. But what about the things that mimic carpal tunnel? Because carpal tunnel is not the only thing that can cause numb, tingly fingers. So we could also be getting some compression of the nerve at its origination up in the cervical spine. So we most commonly think of that as C6 or C5, C6, C7, although it does have originations from C8 and T1 as well. But for the sake of simplicity, let's say it's just these three, C5, C6, C7. So a lot of things could cause that impingement. It could be a herniated disc. It could be a slight movement at the spine where it's tilted, and that could be sometimes because your muscles are so tight that it's just pulling those vertebrae over. So any kind of compression at the spine onto that nerve can cause those same numbness and tingly feelings, but the origination's not the neck. We have to look higher for it. So we might also find it a little bit lower than the spine, so in between the wrist and the neck. And that could be in the brachial plexus right here. We like to call that thoracic outlet syndrome. It's kind of a disease, or it's not a disease, it's a disorder that wasn't as prevalent as it is now as they've learned more and more about it. And there's three types. There's neurological, there's venous, and there's arterial. So the artery and the vein and the nerve all run right up here. And this is another one of those things where it could be anatomical, where it's pressing up because we have a weirdly shaped clavicle. It could be a high first rib, it could be an extra rib, but some sort of bony something is different, and that's pressing down on the nerves or the artery or the vein. So neurological is the most common, and that's going to have the same symptoms as your carpal tunnel, so that numbness, tingling, weakness, pain. If we have like a venous issue, we're more likely to get blood clots, and if you have an arterial issue, not only are we going to be looking for numbness and tingling, but we're going to be looking for temperature changes, color changes, and to see if there's any swelling backing up. But we're going to seek more on the neurological one because that is the more common one. In fact, I suspect I also have that. It is not officially diagnosed, but it is also a diagnosis of exclusion, and I don't have any other reason for some of the symptoms I get sometimes other than I can feel it and I can do things and make it better. So by exclusion, I've diagnosed myself with TOS and chronic carpal tunnel because I sit and type notes all day. However, this has gotten a lot better. So any of those three could mimic carpal tunnel syndrome, and the best way to figure out which one it is to go see your physical therapist and let them check out everything from the top to the bottom, figure out which one's causing it. Is it a true carpal tunnel where it's only isolated at the wrist, or we need to look at some things higher up and decompress some nerves, improve some impingement, and build some strength back in those muscles. So those are three things that could be causing your numb and tingly fingers. And if you need more help diagnosing that, I urge you to reach out to your local PT and ask them to help you figure it out.